everyone. I'm really happy that we are back again together with this series of webinars that we started several months ago. And I'm really happy to see faces again and again. And people are doing really great jobs around the world. And it is really amazing, inspiring to see the progress. So what I'm going to do today, I'm just going to give you an overview about what we have done in the ISAM Global Survey on COVID-19 pandemic and substance use disorder. I'm just presenting on behalf of a large group of colleagues and collaborators that most of them are here on the webinar. So I'm just presenting on behalf of them. So if there is any specific comment that people are interested to add, just jump in and add to the discussions and the data I'm presenting on behalf of a really brilliant group of colleagues and collaborators. Okay, so let me see. Okay, so basically, as you know, we started with putting together something like a theoretical framework, an overview about what are the things that we are expecting to see in terms of the interaction between pandemic and substance use disorder around the world. So we made a specific position paper discussing about what are the challenges that we are thinking that we are going to face in the future. And this position paper has been cited many times during last few months. So the position paper was providing us with something like a theoretical framework about the questions that we need to ask. Because at that period of time, we didn't have any data. So we have been just based on the expectations and previous experiences. So we have been thinking that what are going to be the major challenges in the future. So we started from this specific point. And I asked my colleague, Panyan, to just share the link of the documents that I'm sharing here on the chat space. So you can just go to the chat space and click on the links and see the papers that I'm sharing right now with you. So we started from this position paper, and then we developed a specific research protocol for a global survey. And you can find the details about the research protocol, and we published the research protocol. So the research protocol is already available, so people can see the research protocol. And then we moved forward and ran the global survey. Something like 1 month after the official announcement of the pandemic by WHO. So it was a really good time to just be able to assess what is the effect of pandemic around the world. And based on that, we basically developed 2 data paper from what we collected from that survey. The first data paper is out as a preprint in medRxiv from July 24th, and it describes the challenges for supply, price, and use, and some complications. So it provides an overview about the scene of substance use around the world and the challenges that people are facing. And then the second data paper is about how health sectors around the world responded to these challenges and the difficulties that people in different parts of the world are facing, and the challenges that they are facing in terms of how to optimize their treatment services. And we also provided many details in terms of even recommendations based on the data that we have, things that people need to consider, not only in this pandemic, but also in the next phases, and also probably future pandemics that we all need to be conscious about. So these are the two pieces, and we technically published this one as a preprint something like 2 days ago. So it is out, and it is on medRxiv from something like a few hours ago. So it is really fresh piece of evidence. So people have just started to look inside and the details that we are providing. And I'm not going to basically spoil the entire message that we have in these 2 publications. I'm just going to give you a few pieces of the evidence that we published in these 2 data paper. But I highly recommend you to go to the details that we provided inside. And as you can see here, we have a really interesting, nice group of colleagues here from different disciplines, different countries, contributed to this survey. And I really need to thank all of them to basically put this together. And obviously you can see that people have done a really nice job to make that happen, especially kind of colleagues that I can see here. Alex, ISAM President-elect, Kathleen Brady, Mark Potenza, Shalini, Christos, all the other colleagues, Ali, Dr. Fahudian, Ramin Radfar, Parnian, who is here. And I also need to kind of make a special thank to Mohsen, who is our data mining expert, who has done the analysis and provided all the figures that I'm going to show you. So it's a really nice, interesting group of colleagues and collaborators. And we also have a really nice group of young students and kind of researchers in their early career among the authors. So we try to also train the next generation of those who are going to run these studies. So it is not just senior people. We try to have a mixture of young investigators and senior investigators together to be able to run the study. And if I just click on this, probably can, yeah. So if you just find the paper, and this is the Europe PubMed, you can find the paper in Europe PubMed. And if I go to the paper, to the full text of the paper here, it is not published yet, so it is not peer reviewed. It is still in the process of peer review. So I hope that it would be peer reviewed and get published. But what we have here, if I go to the paper and details that you can see that we have provided, we have also made the list of those who have contributed to the consortium from different countries. So you can see here, we have a list of 177 contributors from 77 different countries around the world. So as you can see here, these are the names of the people who technically contributed to this survey, and we added their name as basically contributors or consortium contributors to the paper, and we have their affiliations. So we try to consider everyone who has contributed to this global survey, and that is going to be a culture that we are going to continue to do for the next global survey. So we are going to kind of try to have a large group of contributors and collaborators to be able to have a global sort of collaborative networks of addiction medicine professionals to be able to make this happen and kind of push that agenda forward. So that's kind of just to give you an idea about how we have group of colleagues here. Okay, as you can see here, we have collaborators from, as you can see, from US, from Iran, India. So this is the number of collaborators that we have. And there are countries that we do not have collaborators. So we do not have collaborators from basically Central Asia, this part of the world. We do not have many collaborators from here, this part of South America, that is another part of the world. There are countries here in Southeast Asia that we do not have collaborators. So I highly kind of encourage others, if you know addiction medicine professionals and experts in these parts of the world that we do not have representatives, please introduce them to us. And even you can use the chat space here or the email that I provided, isam.globalsurveys@gmail.com. So you can just send us the names of the people that you feel that they might be interested to contribute to that global survey. So I really like to kind of encourage others to see how we can make the map, have something like a better global representation of the survey. So that is one of the major missions that I have today, to encourage others to join us and be able to have a better representation about what is happening around the world. So that is one specific point. If you have a specific suggestion, you can do it right now. So you can just even put it under chat space, take something like 30 minutes of your time and just share whatever you can. Let us know in terms of kind of nominating people that could contribute to this global survey. So I'm going to give you an idea about the data that we have and how we try to process the data. They seem complex because we provided the entire kind of database in the figures. So in terms of the changes in alcohol and drug use, if I just want to give you a summary results of what we have. As you can see here, we have 177 contributors from 77 different countries. And this is the response that we have. Overall, as you can see here, as other speakers mentioned, as Kathleen has mentioned, and other colleagues in different parts of the world, it seems that overall we have a significant sort of reduction in terms of major hardcore illicit substance use around the world, and probably an increase in alcohol, cannabis, and sedative prescription opioids. So that is the kind of the general conclusion that we have from the data that we collected around the world. But I don't like very much to just impress you by the quality of the data that we have and the kind of the size of the data that we have. I really like to show you the real data that we have, the challenges that we had inside the database. So I'm just going to give you some other pieces of information that we have in the data. So I provided another cut from the figure. I'm going to show you a few other pieces here. First of all, I'm not really a great fan of bar charts, because I think that bar charts would not give you the details about the data that we have. What we tried here, we provided points for every single response that we recorded inside the database. So as you can see here, all these kind of points are representing one single response. So we try to show the real data, not just the beautiful bar charts that are showing the increase or decrease. So you can see the actual data. And as you can see here, for example, about alcohol, you can see that in general, we reported that there should be an increase in terms of alcohol use. But you can see there is a diversity among different countries. So like here, we have Greece, Indonesia, Iran. They have reported increase in the level of alcohol use. But from India, people reported a decrease in the level of alcohol use. An interesting part is that all 13 responders from India, they were in a level of consensus that the level of alcohol was decreasing in India. And it's quite interesting to see the level of consensus that people have here, or the level of consensus that people had here in Indonesia. Or as you can see here in Iran, there was one person who was thinking that the alcohol was decreasing. So we try to provide every single data point that we have to show the real data that we have in this kind of database. And as you can see here, there are other stories in other pieces of other parts of the world that you can explore, and there are many interesting details that you can get from the data that we provided. Just to give you a few other pieces of information from other parts of the world, as you can see here, in some other countries, we do not have that level of, let's say, consensus. Overall, we had a kind of a response of an increase in the level of alcohol, but we have significant variations in responses in some other countries, like what we have in UK or what we have in US. So we try to kind of provide a good representation of what we have, not just overall responses, but also each individual responses that we have collected from the survey. And this is true when we go back to kind of the entire figure. So you can go back and just see not only the below line that is provided, the overview, overall responses in terms of, okay, we have a decrease, we have increase in these domains, but also going to each individual countries and see how they have responded, and the number of people who have responded from these countries is also provided here in the graph. And we have the same process for all other pieces of information that we provided in these two data papers. So you can see here, this is about changes in alcohol and drug supply. Overall, as other speakers have mentioned, that overall it seems that we have a reduction in terms of the global drugs supply among different drugs, and that is the consensus that we had around kind of the different countries. Also about the changes of the price. As you can see here, this is the overall response. But if I just get focused to the all responders or all countries, then what you can see here is just in all responders, all countries, this is the overall increase in terms of the price for different sort of drugs that we had around the world. And also it is true about the stigmatization and mortalities, as other speakers have mentioned today about these challenges. So as you can see here, overall we have reports of increased stigmatization, increased alcohol mortalities, and drug mortality. So that is what we have. And also about risky behaviors. Then we have decrease in the level of supply and increase in the price. As you can imagine, we have reports of, let's say, increase in terms of the risky behaviors that are related to substance use disorder. That could raise concerns for probably HIV/AIDS and other things that make concerns in the global level as well. So this is the first part, and then overall we ask people to report the severity of problems that they are kind of experiencing, or people with substance use disorder are experiencing in different countries around the world. And as you can see here, this is the global map. So countries like, let's say, US, Iran, China, they reported something like between 8 to 9. This is kind of something like a visual analog scale. There are countries that they have not been affected that much to the kind of the COVID at that period of time. So you can see that there are different versions of report to that. And there are countries that they reported they are more severely kind of affected by substance use disorder. But this is the way that we collected some sort of, as you can imagine here, these are going to be to some extent subjective responses, how people perceive the challenges that people are experiencing from substance use disorder. And then we have the second paper. What I explained you was the first paper. So you can find the first paper and what discuss about it in details. And then there is a second paper specifically on treatment and harm reduction services. So we discuss about services and what is happening with services around the world. And on that paper, we discuss about availability and access to the treatment and harm reduction services in details in different countries around the world. Other services that are provided, something like needle syringe exchange programs, our countries providing PPE for substance use disorder patients. So different things that we have in countries around the world. I'm not going to go to the details of those items, so you can see the responses and the challenge that people are facing around the world. Overall, what we have is, as you can see here, in different levels. This one is specifically on vulnerable population, but we have in most of the services, people are reporting the services that are facing challenges. So something like over 50% of the services for vulnerable people or other treatment services around the world are facing challenges. And we discuss about these challenges and how these challenges should be addressed and how different kind of treatment services or treatment service providers or policymakers need to address these concerns. And then the policies, and also how overall different countries responded to the pandemic, and what are the dimensions of response that should be considered when we make a national policy. What are the dimensions that we need to consider when we want to make a flexible treatment services or health response to the COVID-19 pandemic? What are the dimensions that should be considered? And also, as you can see here, the overall quality of health responses as being perceived by responders. And as you can see here, there are countries like China that they reported they are really happy with the services that they are providing. And there are countries that are not really happy with the services that they are providing. So as you can see here, there is a variation in terms of the how people are perceiving the quality of health response to COVID-19 pandemic around the world. Okay, discussing about what are the things that we are going to do in future. So what would be the next steps? How we can move forward from this point. First of all, we realized during last 3, 4, 5 months of working on this specific line of project that there are definitely lots of great potentials for ISAM to be able to run global surveys in a really good quality. And that is going to be a great advantage for ISAM. And we can do that as something that is going to be really helpful for the addiction medicine community around the world. So we are going to extend the global survey network, and we are going to expand that. we definitely need to have subcommittees discussing about what are the questions that we need to ask around the world. And we need to have experts to ask what is the best question regarding stigma, what is the best question regarding the mortalities and fatalities and the challenges that we have for measuring these things around the world. And we also need to develop even a specific research methodology for being able to run global surveys. And there are specific research challenges and even analysis challenges, how we do data analysis for these global surveys. And we have data from something like 100 countries, from 200, 300 responders, how we are going to do analysis and what are the challenges for data analysis on that level. And one of the most important issues, what are the hypotheses that we want to be tested with these global surveys? We cannot just go and ask hundreds of questions from people without having a specific hypothesis or specific questions. So we are going to encourage everyone who is attending this webinar or this series of webinars, or those who are going to see the YouTube video that we are going to provide, to just join us and share the questions that they like to be answered in the global level. And we are right now providing and planning for the follow-up survey, and we are looking for, basically we are designing the follow-up survey. We are looking for those who are interested to kind of join the subcommittees, ask questions, even contribute to the research methodology. And I think that is going to be something that is going to receive lots of attention within ISAM. And we hope that at the end of the day, with all these, let's say, evidence that we are providing, we can have best practice guidelines based on the evidence that we are collecting around the world. That is something that I think is going to be highly needed. As you can imagine, there are packages, but what we have adapted for COVID-19 is going to be challenging. As you know, we have, for example, a series of neuroscience informed psychoeducation material for people with substance use disorder with different cartoons, but how we can adapt them to material that are going to be helpful for COVID-19 patients. And so we try to develop some specific neuroscience informed material for COVID-19 patients that are freely available. And I will ask my colleagues to just share the links to these materials so you can find those materials. But the challenge is, okay, when we develop these materials, how we can kind of optimize them based on the evidence, and how we can see how these packages are going to be used around the world in different platforms. So just now we have the floor open for further discussions and see how we can move forward together to do something that is going to make a global impact and help addiction medicine professionals around the world to provide better services for their patients. Thank you for your attention.